Hi, my name is Jason Yan, and I'm rising senior in Biophotonics and Imaging Laboratory, led by Professor Ricky from Bioengineering Department. And I'm in the team focusing on the development of a new kind of stroke screening app. In general, people over the age of 55 are considered as the population groups that are more vulnerable to ischemic stroke, which is a common type of the stroke caused by the blockage in the artery that supplies blood to the brain. And currently, there's barely any solution that can effectively detect and prevent the stroke for those at risk. The ultrasound imaging is the common practice used by the hospital to detect the blockage for those patients. However, it's mostly used when the patient develops the symptom, which sometimes is late for the medical treatment. Besides, considering the cost of the ultrasound imaging, it is pretty expensive and less accessible to all of the people in need. So here comes the idea of using the smartphone app for the stroke screening and prevention. So how this app works is that it takes a 10 seconds video of the user's facial area and then calculating the blood perfusion of various spots like the cheek or the forehead, and comparing them, we could find the indication of carotid arteries blockage. In order to get better result, there are some technical issues needs to be addressed. First off, it requires higher video quality in order to get more precise data for the image processing. Second, it requires higher refresh rate for more consistent and smooth signal. Meanwhile, the existing computational resource has to be migrated to a cloud hosting server or platform in order to communicate with the client-side app. Using a smartphone screening app for the stroke prevention could greatly reduce the screening costs for both clinics and patients, providing them with great accessibility as well as usability, especially considering the current situation. Now, more effort needs to be put into research and running tests for validating the solution. Once the app is ready for widespread use, it will help to push the mobile health industry for more and more remote vascular screening solutions and the development of various remote screening apps. Thank you all for being here listening to my presentation, and special thanks to Professor Ricky for the guidance in the lab.